Our approach to the Institute is to make sure that everything we do is practical, is about the real world, about the lives that we touch. The Acenda Institute of Health Innovation is comprised of 5 pillars: our centers of excellence, applied research, policy and advocacy, population health, and our innovation incubator.
When you look at these 5 pillars, they really do work together. They're designed to stand independently, but they also are very much designed to be integrated, and that's what we are looking to do.
For too long, our sector has been providing care with the best of intentions, with noble missions. We're looking at our data, but we don't necessarily know what we don't know. It's time for us to be the epicenter of innovation and advancement within our sector. This is the right and necessary time for this institute because our communities need us now more than ever. Hello, everyone. Thank you so much for joining us today for our 2nd annual Acenda Institute of Health Innovation's Momentum Awards. Now more than ever, our communities are looking to us for answers in response to some of life's most challenging circumstances. At AIHI, we've come to understand that our success will only be achieved through meaningful advancements in advocacy, research, partnership, and innovation. With that in mind, it's AIHI's programming is intentionally designed to unlock the creative energy of our health and human services sector, their leaders, our community members, our public and private sectors, with the common goal of transformative health. The Momentum Awards provide us with a wonderful opportunity to recognize those truly remarkable individuals and organizations that are transforming and strengthening our field. In learning more about the award recipients, I am sure that you will feel, as I do, inspired and motivated to go into our communities to do even more and greater things. And now, without any further ado, let us begin the award ceremony.
Thank you, Anthony. I'm so excited to begin this year's Momentum Awards. The first award we'll be presenting today is our Population Health Leader Award. This award goes to an individual or organization who is focused on improving health for all of the populations in New Jersey, not only making sure that we have positive health outcomes, but also ensuring that we're using innovation, collaborations, and innovative partnerships to move us forward and to ensure that we have equity in health for all. Today's awardee uses innovative partnerships, collaborations at the community level, and really just innovative thinking to make sure that they are engaging as many stakeholders as possible in moving population health forward. At the Acenda Institute for Health Innovation, we value this highly because we know that as we move into this next phase of what healthcare requires and next phase of what our communities deserve, that it does require someone in an organization that is thinking ahead. And today's awardee definitely thinks ahead. It is my great honor to award the 2023 Population Health Leader Award to the South Jersey Institute of Population Health.
The South Jersey Institute for Population Health is honored to receive the Population Health Leader Award for 2023 from Acenda's Institute for Health Innovation. A big thank you to Ms. Melissa Fox, Dr. Monica Lalo, and the Acenda Health team for being a leader in population and community-engaged health for decades and honoring us with this award this year. I'm Dr. Nicole Vaughn, an Associate Professor of Public Health and Wellness in the Department of Health and Exercise Science in the Rowan Virtua School of Nursing and Health Professions at Rowan University. I've been serving as a co-lead from Rowan for the South Jersey Institute for Population Health for the past 2.5 years. My colleague, Dr. Naomi Marmerstein, serves as the other co-lead from Rutgers University Camden. And our leadership team members, Chriselle Allen, Corey Hoffman, and Shania Terry, all work together and help us lead up this work of this new institute, and we are grateful to be recognized. Our work would not be possible without the support of former Mayor Dana Redd and our Oversight Committee. The leadership at our educational institutions have been behind these efforts, so we want to thank Rowan's Provost Tony Lohman, Dean Annette Raboli from Cooper Medical School of Rowan University, and Dr. Donna Nikitas from Rutgers Camden, and Jeffrey Nash of the Joint Board of Governors. The South Jersey Institute for Population Health was initiated by a state grant to connect Rowan, Rutgers Camden, and community stakeholders interested in improving health and advancing health equity in southern New Jersey through population health, population medicine, and public health approaches. Our institute is located at the Joint Health Sciences Center in Camden, New Jersey. A key cornerstone of our work is to have community at the center of these efforts. Our work is focused in the 7 southern New Jersey county region that spans from Burlington to Cape May County. A large part of the work of SJIPH has been focusing on deepening the research collaboration between our respective institutions of Rowan and Rutgers-Camden, as well as beginning to facilitate more community-engaged and community-based work with stakeholders. This collaboration thus far has led us to learn so much about the state of New Jersey and also expand our networks. Much of the health data for the state of New Jersey ranks our region as a leader in many poor health outcomes. We are a vast region with urban, suburban, and rural issues and populations, and they all have similar yet different challenges when trying to achieve health equity. Due to the persistent health disparities in our region, in 2021, the South Jersey Institute for Population Health launched its first funding cycle. 11 projects were funded to address health disparities in 6 of the 7 counties, and we're thrilled. Their research projects spanned the gamut of food access and policy work, health promotion for those with physical and intellectual disabilities, the opioid epidemic, broadband access for seniors, and physical health education for youth and families, as well as many other topic areas. We are currently in the final stages for funding the second cycle of projects and are poised to have 11 additional research projects underway in 2023. SJIPH has designed our funding initiative to allow time to bring all the partners to the table from the beginning and throughout the duration of the project. Dr. Marmerstein will describe our sandbox model developed by myself and Dr. Sarah Allred and how we ensure that community is at the forefront of our work.
At the South Jersey Institute for Population Health, we bring together people from Rowan University, Rutgers University in Camden, and community partners. We strive to create unique partnerships between universities and the community. The Institute assists in the formation of these teams and then brings teams together at a sandbox meeting. At this sandbox meeting, we have a large group session, and then we have breakout groups consisting of each team meeting with a facilitator. The facilitator works with each team in order to discuss their research and programming goals and help them move toward a coherent and actionable research project. After the sandbox meeting, the South Jersey Institute for Population Health reviews these projects. We strive to achieve our goals of true and deep collaborations between university partners and community members.
Over the course of my years working in community-engaged and community-based projects, I have realized that partnerships and the willingness to engage and stay committed to the work despite the many setbacks and challenges is just as important as the project and project deliverables. Beyond providing funding resources, our goal as an institute is to share the results of these projects with the region. We want to continue developing the kinds of partnerships we see here, to support more intersections between higher education and community-based organizations, and our aspiration is to become a research and data hub tailored to the needs of our Southern New Jersey region. Our purpose at the Institute is clear: advance health equity, expand research in the 7-county Southern New Jersey region, ensure a diverse body of work that covers rural, suburban, and urban issues, bring new ideas to the forefront, and have partnerships that are newly initiated or further deepened. SJIPH values collaboration, innovation, and impact as demonstrated by the work we have done and will continue to do in the future. On behalf of myself and Dr. Marmerstein, we would like to thank Acenda for this Population Health Leader Award for 2023. We are truly grateful to be recognized. Thank you.
Hello, I'm Jim Curtin, Acenda Integrated Health's Chief Business and Government Relations Officer. We are thrilled to present this year's Sector Innovator Award to I2I Population Health. The award will be accepted by their Chief Executive Officer, Justin Neese. We as a society are extremely fortunate to have such an innovative company like I2I, who is laser focused on creating innovative population health solutions and services that improve quality outcomes, care management, and consumer experience. I2I believes better care means a better life for all communities. I2I CEO Justin Neese has brought visionary leadership experience from multiple Fortune 500s to early stage growth companies. In his role as CEO, Neese has transformed I2I into one of the top population health management companies in the healthcare technology marketplace. He has developed unique domain knowledge from field work with provider organizations and health plans, launching alternative payment models since 2008. AIHI Population Health is a dynamic, innovative organization which is dedicated to leveraging technology and strategic alliances in order to improve health outcomes and reduce care disparities. Their key areas of focus are reflective of their forward-thinking approach and their commitment to supporting providers and building systems which adapt to the needs of changing and diverse communities across the country. AIHI is the nation's largest population health technology company servicing the underserved safety net market. We applaud AIHI Population Health and rely on them to continue their tremendously innovative work. Congratulations.
Hello, I'm Justin Neese, Chief Executive Officer for AIHI Population Health. We are deeply honored today to receive the Acenda Institute of Health 2023 Momentum Award as the top sector innovator. I speak for every employee at AIHI. Thank you. The journey to receive this honor does start with a company anchored by passionate and dedicated team members. AIHI employees give their all every day to serve others for healthy communities. Our mission is at the heart of who we are and what we strive to be. There are many sacrifices that go into dedicating your professional career and time with any company. Our employees always place our valuable customers at the center of everything we do. Serving others is about putting yourself second. It's about listening to understand, then acting with diligence and care. I personally want to say thank you to our great team. The 2023 Momentum Award represents your dedication to excellence in population health management. I also want to highlight why AIHI continues to innovate our population health technology. For over 20 years, AIHI has been serving federally qualified health centers, community health centers, hospitals, clinics, and health plans across the United States with integrated technology that supports and helps drive community health programs. The voice of the customer is paramount to our solution development. It helps us solve the needs on the ground to improve access to care, community and consumer care coordination, and quality program performance. Without our compassionate clients and resilient customers, there would not be this great opportunity to collaborate and partner to innovate around population health technology solutions. For that, we say thank you to every customer that leverages AIHI solutions. Thank you again, Acenda Institute of Health, for this incredible award. We are very grateful to be named the 2023 Top Sector Innovator.
It is my absolute honor and privilege to recognize the Inspira Health System with our Partnership Award. Inspira Health System is largely recognized for their cutting-edge medical care, but not often understood is the extent to which they partner with other health and human service organizations throughout the region. This partnership comes in many different forms, but always speaks loudly and promptly to their commitment to providing the community with whatever care is going to best support them. There are certain words that Amy Manzu often speaks that I think embody Inspira's commitment to partnership. And those words are, how can we help? What is it that we can do? And their willingness to put action behind those words is what makes all the difference. Supporting and providing technical assistance to organizations, providing letters of support or commitment so they can bring new programs into the region, developing integrated care delivery models where our staff are working side by side with each other. These are just a few examples of the transformational impact that has been experienced through Inspira's partnership. Among other examples that stand out for me are significant improvements in our homelessness programs in Cumberland County, violence and gun prevention intervention services, food insecurity programs and services, and even partnering with Rowan College of South Jersey in order to come up with an innovative workforce solution to be able to bring more nurses and medical techs into the field. If you come up with an idea and they can help support it, you can count on Inspira to support it. My congratulations to the Inspira Health System and my gratitude to Amy Manzu, who's accepting this award on their behalf.
On behalf of Inspira Health, I want to thank Acenda for this tremendous honor of the Momentum Award for Partnership. Partnership is at the core of the responsibility of nonprofit organizations. And I remember the first meeting I think I had with Dr. DeFabio. First of all, there was an immediate connection between the two of us, really trying to say, okay, we both really care deeply about this community. We care deeply about the issues around mental health and how we protect our community and make it healthier and make it better. How do we work together? Obviously, you get another round of COVID and you're still dealing with all those situations, but we never stopped the conversations around what are the things that these two organizations that care often for the same patients can do together to make their journey easier, better, and improve care all the way around. In the meantime, I'm having conversations with Dr. Fred Keating from the Rowan College of South Jersey about the things that we could do together. And what you really see is the energy and the synergies. What are your needs? How do we come together? What are the things we can do? Examples of the long-term partnerships that Inspira has been invested in over the years have really started with the basics of food, water, shelter. How do we make sure that we create that stability to then be able to have that full growth and that full support of a person's mental health? At the beginning of this was the M25 initiative, which then grew into Housing First Collaborative, really looking at how we would support those initiatives. And Inspira has made commitments, both financial as well as through our talent. Our team members have been very involved in literally staging the houses and making sure that we help people get structured in their new homes, obviously providing the support and the referrals to M25 to make sure that those that stability can happen, because you need that shelter, you need that predictability to really be able to begin to get your feet under yourself. We also know that the work with the prosecutor's office that we've been doing and really her leadership for Jennifer Webb McCrae, really looking at how do we address the violence in our community. And then lastly, really looking at the work with Horizon. Horizon has funded, which are one of our payers, has funded a community health worker program. We know that having someone boots on the ground that's helping connect people to Complete Care, to Gateway, to get them eligible or get them enrolled in the programs that they're eligible for through the government, all of that coordination, really sometimes you need that navigator to help with. And having this boots on the ground with us in Millville has been tremendously helpful as we've started this program, and we'll be expanding it next year. All of these are things that can't happen without the trust of the nonprofits, without the leaders willing to work together, and without people like Anthony DeFabio from Acenda, who's willing to sit down and say, let's make the world better. I'm honored to receive this award, but really it's about all of us that are never going to stop our commitment to improving the communities we live in. That's what it means to be successful, and that's what it means to work with great partners like Acenda. Thank you so much.
Wow, that was so amazing. Thank you so much, Inspira, for being such a great partner. Our next Momentum Award is going to go to our advocacy champion. This award is so important because it really is representing the individual that is really out there focused on supporting our communities and being the voice that our communities need. This is the person or organization that is committed to not only being a voice when a voice is needed, but putting the action into place to make things happen for the better. This year's awardee has been a powerful voice within the state of New Jersey in improving the maternal health outcomes for all of the birthing persons in New Jersey. This is so important because we know that disparities exist as it relates to maternal mortality rates. And this is something that we all, as a state and as a country, should be focused on. And this person who we're awarding today has been at the forefront in making this change for our state. I am so proud to say that this year's recipient of the Advocacy Champion Award is the First Lady of the State of New Jersey, Tammy Murphy.
Hello, everyone. This is First Lady Tammy Murphy. It is my honor to welcome you to Acenda's Institute of Health Innovation's Momentum Awards. Over the past several years, it has become increasingly evident that our mental health is not simply as important as our physical health. It is part of our physical health. But taking care of our mental health becomes nearly impossible when we are afraid or ashamed to discuss it. The effects of stress, anxiety, and postpartum depression are not imaginary. They are very real. And they contribute to New Jersey's maternal health crisis, which is why I am so grateful to Acenda for celebrating and elevating the work of those professionals who are using innovative ideas to move behavioral health forward. Sharing the cutting-edge work that is being done in this field, and quite simply, having these conversations plainly and openly, is an important step to change the culture around mental health. So I am grateful not only for your expertise and all of the breakthroughs you have made, but also for your helping more people to become comfortable with this subject. The mission of Nurture NJ is to transform the way we care for mothers and babies in New Jersey, and that includes addressing both the mental health and emotional well-being of our moms. So many women become experts at hiding their own needs and putting everyone else first, especially mothers. Through our maternal and infant health strategic plan, we are working to transform every aspect of society that touches the life of a mother and baby, and behavioral health is no exception. We have already implemented or made headway on over half of the more than 70 recommendations in the plan, and we are constantly reviewing and assessing our progress. One example of our progress is our perinatal episode of care, which encourages coordination of high-quality prenatal, labor, and postpartum care, and one of the key metrics is ensuring patients receive prenatal depression screenings. I also want to highlight that New Jersey was one of the first states in the nation to develop such an episode. As all of you helped to put New Jersey at the cutting edge of behavioral health, I have no doubt that your work will help us reach our goal. So on behalf of New Jersey families, it is my honor to join you in recognizing the incredible contributions of today's honorees. Together, we will make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you.
We are so happy to present the Research Pioneer Award to the Rutgers Center for State Health Policy. The award will be accepted by Joel Cantor. Dr. Cantor and the Rutgers Center for State Health Policy are leaders within the state regarding research related to health-specific policy. Their commitment to quality and impactful research practices is only equaled by their openness to partnerships and community-focused collaboration. Nationally recognized for its contributions to health policy decision-making, the center provides analytic expertise in the areas of access and coverage, health and long-term care workforce, health systems performance improvement, long-term services and supports, and population health. Joel C. Cantor is a distinguished professor of public policy at the Blaustein School of Planning and Public Policy and the founding director of the Center for State Health Policy at Rutgers University in New Brunswick, New Jersey. Dr. Cantor has published widely in the health services and policy literature on innovations in health service delivery for high-need populations and the regulation of health insurance markets. He serves frequently as an advisor on health policy matters to New Jersey state government and was the 2006 recipient of the Rutgers University President's Award for Research in Service to New Jersey. Dr. Cantor currently leads a major study funded by the National Institutes of Health examining the contribution of homelessness to racial, ethnic, and geographic disparities in health services outcomes and how permanent supportive housing can mitigate those disparities. We salute the Rutgers Center for State Health Policy and Dr. Joel Cantor.
Hello, I direct the Rutgers Center for State Health Policy. We're part of the Institute for Health, Healthcare Policy, and Aging Research here at the university. I'm also a professor of public policy at the Edward J. Blaustein School of Planning and Public Policy. I am deeply grateful to the Acenda Institute for Health Innovation on behalf of the Center for State Health Policy for conferring the Research Pioneer Award on us. The mission of the center is to inform, support, and stimulate state health policy in New Jersey and around the nation. And as part of the Institute for Health, we collaborate with others to produce rigorous interdisciplinary research that we can translate to practical action. At the Institute for Health, I direct the New Jersey Population Health Cohort Study. We're in the process of recruiting about 10,000 participants to help inform how stress across the life course can affect all of our health, especially in disadvantaged communities, multi-generational households, and immigrant communities. We want to produce actionable information that can be used by policymakers, community groups, and others to improve health. Achieving this would simply not be possible without our community partners. Looking ahead, we are eager to deepen our relationships with communities, community organizations, so we can maximize our collective efforts to make New Jersey a place that is healthy for all communities.
Thank you so much for taking the time to watch the Acenda Institute of Health Innovation's Momentum Award ceremony. We are so excited and honored to utilize our platform to recognize these 5 amazing award recipients for the impact that they've had across the health and human services sector. If you haven't already done so, please take a moment to view our website so you can learn more about the Institute, take a look at some of our informative resources, and also learn more about our advocacy efforts and some of our upcoming events. Finally, and most importantly, thank you for all that you have and will continue to do in support of the communities we serve. Together, we truly are making a difference.